Good morning, everyone, and welcome. Today, we're going to explore diseases of respiratory system. I'm excited to take you through this important topic. We'll cover the various respiratory diseases, their causes, symptoms, and how they can be managed. So let's get started and dive into the world of respiratory health. Let's take a closer look at the anatomy of the respiratory system. This system is made up of several key parts that work together to help us breathe and provide oxygen to our body. First, we have the nose and nasal cavity, which are the main entry points for air. They also help filter, warm, and moisten the air we breathe. Next is the mouth and oral cavity, which can also serve as an alternative airway, especially during heavy breathing or when the nose is blocked. Then we have the sinuses. These are air-filled spaces in our skull that lighten the skull and also help with voice resonance. Moving further down the throat, we encounter the pharynx, or throat, which acts as a pathway for air and food. Below that, there's the larynx, commonly known as the voice box, which is vital for producing sound and also protects the airway during swallowing. Continuing downward, we find the trachea, or windpipe, which carries air from the larynx down into the lungs. The trachea splits into large airways called bronchi, which lead into each lung. Inside the lungs, oxygen is exchanged with carbon dioxide through tiny air sacs called alveoli. The entire process is supported by the diaphragm, a dome-shaped muscle that contracts and relaxes to enable lung expansion and contraction during breathing. Understanding these parts helps us see how the respiratory system functions as a coordinated team to keep us alive and healthy, linking directly to our overall theme of respiratory health and function. Let's take a closer look at the anatomy of the respiratory system, starting with the nose, which is quite a fascinating structure. The nose can be divided into two parts, the internal and external nose. Today, we'll focus on the external nose first. The external nose has several key components. At the very top, we have the nasal root, which is essentially the superior part of the nose, the area right between the eyes. Moving downward, we encounter the nasal dorsum, which is the bridge that runs from the root to the apex, or the tip of the nose. The apex is what we commonly think of as the tip of the nose, the most protruding part. Below the apex, you'll find the nostrils, which are the openings leading into the nasal cavity. These openings are crucial because they allow air to enter and exit the respiratory system. Another important structure is the septum. The nasal septum is a wall made of cartilage and bone that helps divide the nasal cavity into two separate chambers. This division is essential for proper airflow and also plays a role in supporting the structure of the nose. Understanding these components is fundamental because they all work together to facilitate breathing, filter the air we breathe, and even influence our sense of smell. These features are integral to the overall function of the respiratory system, connecting the anatomy to its vital roles in our health and well-being. Let's take a closer look at the anatomy of the respiratory system, starting with the internal nose. Inside the nose, we find the nasal cavity, which is essentially the main air passageway. It's divided by a structure called the septum, which separates the left and right sides. One of the most interesting features here are the turbinates. These are curved, bony ridges covered with mucous membranes. They play a crucial role in warming and humidifying the air we breathe in, making sure it's at the right temperature and moisture level before it reaches the lungs. We also have the sinuses, which are air-filled spaces within the bones of the skull. They help lighten the weight of the skull and also contribute to warming and moistening the air. And of course, the mucous membrane lining all these structures is vital. It traps dust, microbes, and other particles, providing a first line of defense for our respiratory system. Overall, these components work together seamlessly to prepare the air for the delicate tissues of the lungs, highlighting how intricately designed our respiratory anatomy really is. Let's take a closer look at the anatomy of the respiratory system, starting with the nasopharynx. The nasopharynx is the uppermost part of the pharynx, located right behind the nasal cavity and just above the soft palate. It plays a vital role in breathing because it connects the nasal cavity to the oropharynx, allowing air to pass through. Additionally, it's important for drainage of fluids from the middle ear, which helps prevent infections. You'll also find the eustachian tube and adenoids within this region, both of which are key in maintaining ear health and immune response. Moving on to the sinuses, these are air-filled spaces nestled within the bones of the skull, mainly around the face and nasal cavity. They might seem like small cavities, but they have big functions, such as lightening the skull and helping to warm and humidify the air we breathe. The main types of sinuses include the frontal, ethmoids, sphenoid, and maxillary sinuses. Each of these has its own location and role, but collectively, they contribute to our respiratory health and the overall function of the respiratory system. Understanding these structures helps us appreciate how interconnected and complex our respiratory anatomy truly is, which ties into the overall theme of respiratory function and health. Let's take a closer look at the anatomy of the respiratory system, starting with the larynx, which is also known as the voice box. The larynx is a pretty complex organ located in the neck, and it plays several vital roles. It's responsible for producing our voice, allowing us to speak and sing. It also plays a key role in breathing by ensuring airflow is properly directed. And importantly, during swallowing, the larynx helps protect the airway so that food and liquids don't go down the wrong pipe. The structure of the larynx is quite intricate. It's made up of 9 cartilages, which are kind of like sturdy, flexible pieces of cartilage that give it shape and support. Along with these cartilages, there are muscles, ligaments, and a mucous membrane that line the inside, all working together to perform its functions efficiently. Now, to better understand its organization, the larynx is divided into 3 main regions. The top part is called the supraglottis, which includes structures above the vocal cords. The middle part is the glottis, where the vocal cords are located. This is essential for voice production. And finally, the subglottis is the area below the vocal cords, leading down towards the trachea. Connecting this back to our overall theme, understanding the detailed anatomy of the larynx helps us appreciate how interconnected its structure and functions are. It's a remarkable example of how form supports vital functions in the respiratory and vocal systems. Let's take a closer look at the anatomy of the respiratory system, specifically focusing on the cartilages of the larynx. First, we'll discuss the unpaired cartilages. The epiglottis is a leaf-shaped cartilage that plays a crucial role during swallowing. When we swallow, it flips down to cover the glottis, effectively preventing food from entering the airway. This simple movement is vital for protecting our respiratory passages. Next is the thyroid cartilage, which is the largest of the laryngeal cartilages. It's the structure that forms the prominent Adam's apple and provides essential structural support to the larynx, maintaining its shape and integrity. Then we have the cricoid cartilage, which is ring-shaped. It forms the base of the larynx and articulates with the thyroid cartilage. This connection is important for the stability and movement of the larynx during voice production and breathing, as shown in diagrams like those on Teach Me Anatomy. Moving on to the paired cartilages, the arytenoid cartilages are pyramid-shaped and articulate with the cricoid cartilage. These are key attachment points for the vocal folds and the muscles that control their movement, directly influencing voice pitch and sound production. The corniculate cartilages are small and cone-shaped, articulating with the arytenoids. They assist in the movement and function of the arytenoids and vocal folds. Lastly, we have the cuneiform cartilages, which are small, rod-shaped structures embedded within the aryepiglottic folds. They provide additional support and help maintain the airway during phonation and swallowing. Together, these cartilages form a complex structure that is essential not only for protecting the airway, but also for voice production and breathing. Understanding their functions helps us appreciate how intricate and vital the larynx truly is in our respiratory system. Let's take a closer look at the anatomy of the respiratory system, starting with the trachea. The trachea is a flexible, semi-rigid tube that connects the larynx, or voice box, to the bronchi, which are the main passageways leading to the lungs. It's primarily made up of C-shaped hyaline cartilage rings, which are really important because they provide structural support and prevent the trachea from collapsing when we breathe in and out. Moving on to the bronchi, These are the two large tubes that carry air from the windpipe into each lung. You have a left and a right main bronchus, one for each lung. Once inside the lungs, these bronchi branch out into smaller tubes that resemble tree branches, which is why you'll often hear them called bronchial branches. It's worth noting that many respiratory conditions, like asthma or bronchitis, can affect these bronchi, making them inflamed or constricted. Now, from the bronchi, we have smaller airways called bronchioles. These are the tiny tubes that continue branching out within the lungs. Unlike the bronchi, bronchioles lack cartilage and glands, but they do have smooth muscle in their walls, which allows them to constrict or relax as needed. They also have a lining of ciliated cells, which help move mucus and trapped particles out of the lungs. Understanding these key parts, the trachea, bronchi, and bronchioles, helps us see how air travels efficiently into the lungs, which is essential for proper respiration and overall health. Let's take a closer look at the anatomy of the respiratory system, starting with the lungs. The lungs are paired, pyramid-shaped organs that sit in the thoracic cavity. Each lung is connected to the trachea through the right and left bronchi, which serve as the main air passages. The lungs have several important parts: an apex at the top, a base at the bottom, and various surfaces. These include the costal surface, which faces the ribs, the mediastinal surface, which is towards the middle of the chest, and the diaphragmatic surface resting on the diaphragm. Now, it's interesting to note that the right lung has 3 lobes: superior, middle, and inferior, making it slightly larger and more divided. The left lung, on the other hand, has 2 lobes, superior and inferior. This asymmetry is partly due to the space taken up by the heart on the left side. Moving on to the diaphragm, this is a dome-shaped skeletal muscle that separates the chest cavity from the abdominal cavity. It plays a crucial role in breathing. When you inhale, the diaphragm contracts and moves downward, increasing the volume of the chest cavity. This creates a pressure difference that allows air to rush into the lungs. Essentially, the diaphragm is the primary muscle driving the process of respiration, making it central to how we breathe and oxygenate our bodies. Today, I'll be talking about some of the common diseases of the respiratory system that you should be aware of. First, we have pneumonia, which is an infection that inflames the air sacs in one or both lungs. It can be caused by bacteria, viruses, or fungi, and symptoms often include cough, fever, and difficulty breathing. Pneumonia can be quite serious, especially for vulnerable populations like the elderly or those with weakened immune systems. Next, let's look at COPD, or chronic obstructive pulmonary disease. This is a progressive condition that makes it hard to breathe over time. It's mostly caused by long-term exposure to irritants like cigarette smoke, leading to airflow obstruction. COPD includes conditions like emphysema and chronic bronchitis, and managing it requires ongoing treatment and lifestyle adjustments. Then we have asthma, which is a condition characterized by inflammation and narrowing of the airways. Unlike COPD, asthma is often triggered by allergens, exercise, or irritants. It causes episodes of wheezing, shortness of breath, and coughing, but with proper management, many people can live normal, active lives. Finally, influenza or the flu is a highly contagious viral infection. It can cause mild to severe illness, with symptoms like fever, body aches, sore throat, and fatigue. Vaccination is key in preventing the flu, especially during peak seasons, and prompt treatment can reduce complications. Connecting all these points to our overall theme, understanding these respiratory diseases emphasizes the importance of early detection, prevention, and management to reduce their impact on health and quality of life. Pneumonia is a lung infection that causes inflammation in the air sacs of the lungs. When these sacs become inflamed, they can fill up with fluid or pus, which makes it really hard to breathe. Now, this condition can be caused by different infectious agents like bacteria, viruses, or fungi, so the treatment can vary depending on what's causing it. Symptoms can range quite a bit, from mild to severe. Some common signs include a cough, fever, chills, and difficulty breathing. It's important to recognize these because pneumonia can become serious if not treated properly. Another key point is how pneumonia spreads. It's often transmitted through respiratory droplets, so when someone infected coughs, sneezes, or even talks, tiny droplets carrying the infectious agents can land in others' mouths or noses, leading to infection. As for treatment, it really depends on the cause. If it's bacterial pneumonia, antibiotics are usually effective. For viral pneumonia, supportive care, like rest, fluids, and medications to ease symptoms, is typically recommended. Overall, understanding pneumonia helps us see how important it is to prevent infections and seek timely treatment when symptoms appear. It ties back to the overall theme of respiratory health and the importance of controlling infectious diseases. Today, I want to talk about COPD, which stands for chronic obstructive pulmonary disease. It's a progressive lung condition, meaning it gradually worsens over time, and it makes it really difficult to breathe. Essentially, COPD causes airflow limitation and inflammation in both the airways and the lung tissues. It's important to understand that COPD is a chronic condition. Once the damage occurs, it's not fully reversible. That's a key point because it highlights the importance of managing and preventing further deterioration. Now, when we talk about chronic obstructive pulmonary disease with acute exacerbation, we're referring to those moments when someone with COPD suddenly experiences a significant worsening of their respiratory symptoms. This can happen unexpectedly and often means they need additional treatment beyond their usual medications. These exacerbations can be triggered by various factors, such as infections, environmental pollutants, or other irritants. If these episodes aren't managed properly, they can lead to hospitalization or cause a decline in lung function, making it even harder to breathe. So, recognizing these exacerbations is crucial, as they are a key part of managing COPD effectively and minimizing its impact over time. Let's talk about asthma, a condition where the airways in the lungs become inflamed, narrow, and swollen, which causes the production of extra mucus. This combination makes it difficult to breathe. Asthma can range from minor to more severe, sometimes interfering with daily activities, and in some cases, it can even lead to life-threatening attacks. Now, when we look at the different types of asthma based on severity, the first is intermittent. Here, symptoms happen less than twice a week, so it's relatively infrequent. Moving up, we have mild intermittent, where symptoms occur more than twice a week but not every day. That means the person experiences symptoms more often, but still not on a daily basis. Next is moderate persistent asthma. In this case, symptoms are happening every day or at least once a week, which can really impact daily life. Then, there's severe persistent asthma, which is the most serious form. Here, symptoms occur daily and at least once a week, often limiting daily activities significantly. Finally, we have mild persistent asthma, where symptoms happen more than twice a week but not every day, and there might be up to 4 nights a month where symptoms disturb sleep. Understanding these differences helps us see how asthma varies from person to person, and it underscores the importance of tailored treatment approaches. Recognizing the severity is key in managing the condition effectively and improving quality of life. Influenza, or the flu, is a common viral infection that can sometimes be deadly, especially for certain high-risk groups like the elderly, young children, or those with weakened immune systems. It primarily targets the lungs, nose, and throat, causing symptoms like fever, cough, sore throat, and body aches. There are several types of influenza viruses we need to be aware of. Influenza A is the most harmful of the bunch. It has the ability to cause severe illness and has been responsible for past pandemics. This makes it particularly important from a public health perspective. Influenza B, on the other hand, is generally less severe than type A still. It can cause serious illness, especially in vulnerable populations, so we shouldn't overlook its potential impact. Interestingly, influenza B is mostly found in humans, which differentiates it from other types. Then we have influenza C, which tends to cause milder respiratory infections and is less of a concern overall. And finally, influenza D primarily infects cattle and is not known to cause illness in humans, so it's less relevant for human health, but still part of the bigger picture of influenza viruses. Understanding these different types helps us grasp how complex and adaptable the influenza virus is, and why vaccination and preventive measures remain so crucial in our efforts to protect public health. When coding for pneumonia, the most important thing is to accurately identify the type and cause of the infection. This means using the correct ICD-10-CM codes to ensure the reporting is precise. If the specific organism causing the pneumonia isn't documented, you should use the general code, J189. It's essential to identify the type and cause of pneumonia clearly, whether it's viral, bacterial, caused by other infectious organisms, or related to ventilator-associated pneumonia. Knowing this helps ensure proper coding and, ultimately, better patient care documentation. Don't forget to consider underlying conditions. If the pneumonia occurs as a complication of another disease, like influenza, you need to code both the pneumonia and that underlying condition. This comprehensive approach helps provide a complete picture of the patient's health status and the factors involved. These guidelines are all about accurate and thorough coding, which supports quality reporting and appropriate resource allocation. Keep these principles in mind as part of the overall coding strategy. When it comes to coding influenza accurately, it's really important to differentiate between various types of influenza viruses. For example, we need to identify whether the virus is a novel strain, zoonotic, or another type. This helps ensure we use the correct ICD-10-CM codes. Specifically, for novel influenza of viruses like H1N1 or H5N1, we assign the code J09. These are typically new strains that may have emerged recently or are of particular concern. On the other hand, if the influenza virus has been identified as A, B, or C, then the appropriate code is J10. These are more common strains that we encounter regularly. And if, for some reason, the influenza type isn't identified at all, then the default code is J11. So, the key takeaway here is that precise classification of the virus directly impacts coding accuracy, which in turn affects surveillance and reporting. This is a crucial part of our overall effort to track and manage influenza effectively. When coding for COPD and asthma, it's important to understand where to find the appropriate codes. For COPD, you'll generally look under category J44, and for asthma, the relevant codes are usually in category J45. Now, things get a bit more nuanced when a patient has both conditions. In that case, the primary code should be J44, which is for COPD. But if the documentation specifies the type of asthma, you'll want to add an additional code from the J45 category to capture that detail. For example, if a patient has both mild intermittent asthma and COPD, you would code it as J4489. This code indicates other specified chronic obstructive pulmonary disease and helps specify that asthma is also involved. Another important point is when the patient is experiencing an exacerbation of asthma. In that situation, you'd need to specify the exacerbation's status using a code from the J452X subcategory. Finally, the key to accurate coding is to always aim for the most specific type of asthma as documented by the provider. Being precise ensures clear communication and appropriate billing, which ties back to the overall theme of accurate, effective documentation and coding practices. Let's take a closer look at the coding guidelines for ventilator-associated pneumonia, or VAP. VAP is a lung infection that can develop in patients who are on a ventilator for more than 48 hours. It's important to accurately document this condition for proper billing and reimbursement. The specific ICD-10-CM code for VAP is J95851, and this code indicates the diagnosis of ventilator-associated pneumonia. If the causative organism is identified, you should code it separately using B95, B96, or B97 codes. This helps provide a complete clinical picture. Now, when a patient is admitted with pneumonia and then develops VAP, the coding process involves a few key points. First, you need to code the general pneumonia category, which falls within J12 to J18. Then, add the J95851 code for VAP itself. And finally, if you know the causative organism, include the appropriate B95, B96, or B97 code. Connecting this to our overall theme, accurate coding ensures clear communication about the patient's condition and supports proper reimbursement. It also highlights the importance of meticulous documentation, especially when a patient develops complications like VAP during hospitalization. Today, I want to highlight some important coding guidelines related to vaping disorders. Vaping has been linked to a variety of health issues, ranging from lung injuries like EVALI, which stands for e-cigarette or vaping product use-associated lung injury, to conditions such as lipoid pneumonia and hypersensitivity pneumonitis. These are serious respiratory problems that clinicians need to be aware of. Additionally, vaping can exacerbate existing conditions like asthma, cause lung scarring, and even lead to damage of other organs. When documenting these cases, the ICD-10 code to use is U070, and it should be followed by the specific disorder related to vaping. Understanding these guidelines is crucial for accurate diagnosis coding, which in turn supports better tracking of vaping-related health issues and helps inform public health responses. Remember, properly coding these disorders not only ensures clarity in medical records, but also plays a vital role in monitoring the impact of vaping on public health.